Mid-1990s, in my laboratory, we did the very first successful version of laser hair removal. That's where you build a laser that's absorbed by melanin in the hair shaft, and you target the reproductive part of the hair follicle that produces hair. And here we have sebaceous gland is another part of the same structure, the hair follicle. It's just that we are trying to kill the gland and not the hair. That was interesting. Long time ago, we looked to see, does laser hair removal hurt the gland? The answer was no. In fact, the sebum output goes up after laser hair removal. There's no injury to the gland. And I think what we're seeing now with this new laser, the Accure laser, is that you can hurt the gland without hurting the hair, right? So inside the hair follicle, you've got these two structures that are neighbors, but they don't depend on one another. And the biology of that is still quite interesting to me. So why do we have sebaceous glands? You know, if you know for sure why we have sebaceous glands, will you please tell me? Because I don't know. If you're a duck, you need sebaceous glands in order to float, right? Many animals use the waxes that are released by the gland to coat the hair. But why do we? We're not ducks. Is it a moisturizer? No, it's not. There's almost no evidence that the oils are really moisturizing your skin. Is it antibacterial? No, it feeds bacteria. Bacteria love to eat sebum. Maybe there's some pheromones. Some animals, probably not us though, send social signals by some of the secretions. In humans, the best thing I could come up with is this. You have in your skin, you have two glands. You have an eccrine gland that's clearly associated with cooling you down. And now you have also this oil secreting gland, which reduces the rate of evaporative loss. And if you look at human sebum output, it goes up in the cold time of year. So where I live in Boston, in the winter time, people have oilier skin. So who knows? I don't know why we have these sebaceous glands, but they certainly cause a big problem called acne. So what happens if we were to selectively and permanently decrease the large sebaceous glands? And when we first started this project, people would ask me, well, you're going to hurt the skin, you're going to get rid of the oil glands. The truth is that children have essentially zero sebum output, right? Until the androgens appear at puberty, the skin basically has zero sebaceous function going on. And they have beautiful skin. They don't have acne. They don't have rosacea, they don't have dry eye, they don't have demodex crawling around having sex in their follicles, right? So I think that it's okay to kill the large sebaceous glands. Here's this reference by Warifon Manuschiati, who showed that laser hair removal does not damage the sebaceous glands. It's a very interesting story. So I think our goal for treating acne with a laser is actually to target only the large glands. And I think that's an important part. You'll see in a minute, this laser was literally built with that in mind. So I'm going to talk now about selective photothermolysis. How is it that we came up over many years with knowing what wavelengths to use, what pulse durations, and how to control the process. So in this cartoon, it's just kind of a bad cartoon. I actually did this cartoon myself years ago, and you can see I'm not an artist, okay? But the basic strategy is to use some version of cooling at the surface and to cool the skin, the superficial part of the skin, the top millimeter or so. The sebaceous glands are always at least a millimeter deep. It's actually 0.35 or 0.75 millimeters up to 1.5 millimeters deep. So they're in the mid-dermis is where they're located. And you cool the upper part of the skin and then come along with a laser pulse that is selectively absorbed and hopefully kill the sebaceous gland. So choosing a wavelength was the first part of this, and together with Dieter Monstein, when he was a fellow in my lab, we ran a bunch of absorption spectra. I went around the lab literally gathering sebum from people's noses and putting that in a spectrophotometer to try to understand the optics of human skin, of human sebum. And this, from that early publication, is shown here. In the red is the absorption of the sebaceous lipids that are in the gland, and in the black is water, and in the blue is the combination of the two. And there are two wavelengths of interest, 1210 nanometers and 1726 nanometers, where there's just a little bit higher absorption by the sebum than the dermis, or the water that surrounds the gland. And both of those wavelengths are capable of reaching the gland. There's other wavelengths where the absorption is much higher and it's very selective, but those wavelengths don't penetrate to the gland. So we ran a fairly exhaustive theoretical analysis on the situation and chose the 1726 nanometer wavelength as the most likely one to work on. I can tell you that I think 1210 nanometers, you could build a laser at that wavelength that would also treat sebum, treat acne. So at the time, this was around 2008, a long time ago, there were absolutely no lasers or other light sources at that wavelength with enough power to do the experiments. In the United States, in Newport News, Virginia, the US Navy built a giant laser. And that picture on the left in this slide, if you look out the airplane window, as the airplane comes into the Newport News, Virginia town, you see this thing that looks like a racetrack. That is a high energy superconducting electron accelerator storage ring. About a third of the helium in the country is in this one facility. It's filled with liquid helium running at very low temperatures. And attached to that, one of the buildings on that picture is where the free electron laser is housed. I was passionate enough that I talked the US Navy and the Jefferson Accelerator group into letting us use this facility for a couple of days. It cost like $10,000 an hour to run this laser, and they gave it to me for a couple of days for free. It's like, yeah, okay, this is great. So this laser, what happens with a free electron laser? Lasers are named for the matter that produces the light, and in this case, there is no solid matter. It's just free electrons moving at nearly the speed of light. You wiggle them through magnetic fields that sets up these quantum states, and very much like the states of electrons will experience in orbiting a nucleus inside matter, you now have the possibility of having electrons jump between orbital levels, in this case just between quantum state levels, and you can turn that into a laser. It's a free electron laser because there's no chunk of matter doing it. This is just the electrons moving through a field. So we use that, and the advantage of that laser is it produces kilowatts of power, very powerful. And you can tune it to any wavelength you want, from the ultraviolet all the way through the far infrared. And in doing this experiment, I became very good friends with Fred Dilla, the guy who designed and built that laser. He's the president of the American Physical Society. We had a lot of fun running around in his accelerator. And this is the lead author there, Fernanda Sakamoto, at that time was a fellow, and I fell in love with her, and she's my wife now. Okay, so out of this experiment came very many good things. Anyway, we used that machine and we proved beyond a shadow of a doubt that you can, in fact, damage the sebaceous glands selectively, and that it fit together with the theory. at 1726 nanometers, there's a wavelength range shown here because that particular laser, the wavelength is not well defined. So we knew it was within about 10 nanometers or so. And if you calculate the thermal relaxation time for a large sebaceous gland, it's on the order of 100 milliseconds. So, and then 80 joules per square centimeter. Those were the conditions that ended up producing the histology that you can see here. And that histology, by the way, was not done in vivo, but it was absolutely fresh, live human skin. I went to a plastic surgeon that was down the street from the accelerator and talked him into giving me tissue to do this experiment. So for those of you that love mathematics, you'll like me for this slide. For those of you that don't worry about it. If you look at the temperature rise that happens when an optical source is absorbed by something, the stuff that matters are shown here, the local fluence. That's the amount of energy joules per square centimeter that are present at the target. The selective light absorption is described by mu A. And for the sebaceous gland at 1726 nanometers, you have about a factor of 1.5 to your advantage. There's only 50% greater absorption at this wavelength. This is just barely enough to do the job. The sebaceous gland has a lower heat capacity, that's rho C, than the surrounding aqueous tissue. And that helps you a lot because the heat capacity is in the denominator. And so between the selective light absorption and the lower heat capacity, you have this about a factor of 2. So the glands are getting about twice as hot as the surrounding dermis when you turn the light on. And then this last factor, and actually this talk is the first time I've showed this. It's important. That if you play with the pulse duration, you can selectively affect the largest glands. And the reason for that is small things cool quickly, right? So small glands have a faster ability to get rid of their heat. The pulse duration, if the pulse duration is greater than the thermal relaxation time for some object, it then becomes inefficient heating. And you want that in this setting. So this laser is the pulse duration and the sequence of pulses that are in the Accure laser are specifically chosen to affect the large glands that, thanks to Al Kligman, we know are associated with the disease of acne. So this is not a laser that kills all the sebaceous glands. It kills the glands that cause the disorder. So why did it take so long? 2008 is when we did those experiments with the free electron laser. And at the time, there just wasn't a practical laser. And in the intervening 20 years, there's a tremendous amount of improvement that's happened in the near and mid-infrared. So a lot of that is due to optical fiber communications technology. So fiber lasers are now one of the most efficient and high-power laser sources in the planet. The Accure laser has in it high-energy fiber laser systems that are running at 1726 nanometers. And I don't need to explain what's in there, but this laser is an example of really new high-efficiency fiber lasers. It's interesting that those lasers are so robust. They have no moving parts. They don't have mirrors in them. That the lifetime of a fiber laser is greater than your lifetime, right? So when they made fiber optic communications around planet Earth, they had to come up with something that really would last for a long time, and then we just kind of climbed on that wagon. So the other thing that's inside the Accure laser, which is unique to this laser, is something called preconditioning. The device sends in pulses at this wavelength, and then it has a thermal camera that's watching the skin temperature. So you put in a little test pulse and you say, oh, well, how hot did this person's skin get, right? And so what you're doing, what it's able to do is to literally calibrate itself for that patient. The laser is smart in this regard. So if you look across this room, we all have different skin colors. That has nothing to do with this laser, right? At 1726 nanometers, there is no skin color. There's just different amounts of water and oil. And there's a pretty large variation among people in the amount of oil and water that we have, if you're dehydrated or hydrated, or if you have more or less oil in your skin. And we learned along the way that we had to compensate for that. So the laser is set up to measure your personal response at this wavelength with a couple of test pulses. They also heat the sebaceous glands, not to the point of destruction, but those test pulses are doing something else, which is warming up the target, all right? And then, having calibrated and said, okay, now I know I can go kill this gland, and the laser sets up a fluence that comes in, and this is controlled by watching what's called PET, the peak epidermal temperature. So I'm actually very proud of that. A lot of work went into making this laser individualized for that patient and safe, but also pushing the limits of effectiveness, right? So instead of having to do a whole bunch of treatments, you really have just a handful of treatments that get you what you want. So this is the only laser that does that. And here's just on the right-hand side of this slide are some histologies. When we figured that part out, we also were able to treat the deeper parts of the sebaceous gland. So this goes down well beyond 2 millimeters. So there's nowhere for the gland to hide. So I don't need to show a bunch of histology, but it's been very fun to look at this. With minimal selectivity, on the optical side, we are able to really reliably kill the glands. And that really has to do with this smart handpiece. So with this device, you treat to temperature. You don't set the fluence. You set the peak epidermal temperature, typically in the range of 40 to 46. 46 is too much, believe me, but 43, typical number. And as you treat your patients, you can begin to, of course, adjust it. You're still in charge. It's not, the laser's not a robot, but it's helping you to individualize the therapy. Also, that PET depends a little bit on the facial region that you're treating, right? So on the forehead, it's a little different than the lower face. And that has to do with the thickness of the skin and stuff. So these are not my patients. I decided not to do the pivotal clinical trial in the States. It was done by Emil Tengetti and Roy Geronimus for this laser. And these are just some of their examples. Very nice. And one of the very, I think, wonderful things about this laser is how it's skin type independent. So here's an example. 2 years after, we started doing the clinical trials just before the COVID pandemic, right? Which was horrible. We had to stop the clinical trials and start all over again because we were unable to see the patients. However, in a way it was good because there was a cohort of patients that were only treated once or twice, right? And then COVID went by, and then years later we chased them down. How are they doing? And they're acne-free with no drugs, right? So COVID was a sort of real world test of what happens when you just treat these patients and walk away. And they were quite happy. As I mentioned, it's skin type independent. Here's an African-American woman, and I love the fact that you don't have to think about skin pigmentation here. Having said that, it's not that you'll never see PIH. You have to remember that acne itself in a darker skinned person, and I'm sure it's true in Asian skin, you have these inflammatory lesions, and then you end up with post-inflammatory hyperpigmentation that can last for months to years. So, of course, you see the PIH from the active lesions that they had at the time of treatments. But the laser itself is actually pretty good at not causing PIH. And I think that's because it's actively monitoring the epidermal temperature. That's the kicker for the pigmentary system. So anyway, that's it. This is the very first practical laser for treating the first reason that people come to your dermatology office. So I'm very excited about this. It took like forever to do this work. Usually it doesn't take this long. I think laser hair removal took me 3 years. I mean, this was almost 20. Highly effective. The clinical data is clear. I didn't go through all the publications. It's long-lasting improvement in over 80%. I think it's actually over 90% of the patients. Before we came up here, someone was asking me, are there people that don't respond? Yes, there are. It's probably on the order of 5 to 10%. So you have to tell your patients they may not respond. Why do they not respond? I don't know. We should find that out. Maybe they don't have enough lipid. You have to remember the laser is targeting lipid. And so we probably have different amounts of lipid production in our sebaceous glands. Or perhaps there's something else about them. But the good news is that in about 90% plus of patients, you're going to get excellent results. 3 to 4 treatments, given we do 1 month apart. I don't know what the ideal duration is between treatments. Typically you can discontinue the acne drugs that they're on, but you don't have to. I don't think there's any drug interaction with this device. And if anybody finds otherwise, how many people here actually have one of these in your practice? All right, so I'm here to learn from you, all right? I want to hear all of your comments and questions, and I think we're gonna have a chance to talk about cases and stuff a little bit later. It's well tolerated with either topical or injection anesthesia, but you need to tell your patients it hurts. It hurts to destroy your sebaceous gland, right? And I'll leave it up to you. You clean the skin. It's really important to clean the skin. Do not let them have sunscreens and moisturizers, particularly things that are oily, on the skin at the time, because you have to remember this is targeting the lipids. And another little caveat is if you can avoid treating very inflamed lesions. What are we doing with this laser? Are we treating the lesions of acne? No, we're not. We're preventing future acne, right? If you have an inflamed, cystic pustular nodule there, treating it with this laser doesn't do anything. That is a hair follicle that's in the process of committing suicide. Right? Acne lesions are hair follicles committing suicide. So coming in with a laser to zap something that's already going to die, it actually doesn't add anything to the party. So when you use this laser, if you have a very inflamed lesion, you can avoid it. You can treat it if you want. I don't think it's going to hurt anybody. And then, as I mentioned, any skin type can be treated. So what's next? I think this is my last slide, or close to it. I think we're at the cusp right now of getting worldwide experience with this new device. And those of you who have and use this in your practice, think of yourselves as pioneers in a way. You can potentially treat all sorts of things. There are many subtypes of acne. There's the menopausal acne that women face at menopause. It's probably just the same as the other ones. There's polycystic ovary syndrome. If you have a patient with PCOS on, let's say, spironolactone, I would probably leave them on spironolactone and do this treatment instead of taking it off and letting their acne flare. There's chemical acne, and I think we have very little experience with this for patients on lithium or other chemical exposures where they get sort of chloracne. It's a different pathophysiology. It still depends on the sebaceous function, but there's a additional thing in there. I have no experience with them, so I'm curious if you do. We don't know anything about the presence or absence of synergy with different drugs. I think you could argue that things like the tetracyclines would be helpful here because they're sort of have an anti-inflammatory, antibacterial flavor to them, working by different mechanism than the laser. And that's something that you can discover in practice. When we did the clinical trials in the States and in Europe for this laser, we had to take everybody off all their drugs. So we don't know anything about it. We just don't know anything about it. And now in your practice, you can learn what to do. And then I think this is really interesting. What are the other lesions that you could treat? Don't think of this as a laser for acne. Think of this as a laser that's looking for lipid, right? And so sebaceous hyperplasia, absolutely, you can treat that. It works pretty well. I'll warn you, if it's a very large sebaceous hyperplasia, turn the laser down, right? It's just too much, right? So you learn to adjust the dose to the lesion. Steatocystoma multiplex probably would work. I have absolutely no experience with it, right? People who have that autosomal dominant condition hate it, right? It's a lipid-filled cyst right in the middle of their dermis. Probably this laser will work great. I have no idea. I've never treated them. Xanthelasma, particularly palpebral, probably would work well. Again, I would, if you're going to do this stuff, turn the laser down to start with and see what you can do. And then just as a little thought at the end, I think rosacea, you know, there are two common conditions that are very associated with sebaceous gland pathology. One of them is rosacea. This morning we saw a great case of the rhinophyma that was treated. So you have sebaceous hyperplasia, but probably people with rosacea will improve with this laser. I don't think it's the reason to build the laser or to use it, but you might just watch and see if the patients who have that. And then the other thing is dry eye. About 60% of patients with dry eye syndrome, the pathophysiology is probably associated mostly with Demodex, which is a commensal pathogen that's eating sebum. And I would expect to see the Demodex population go down and the dry eye improve. We see improvement in dry eye when we treat rosacea, for example, with pulse dye lasers or green lasers or other ones through a similar mechanism. The Demodex, by the way, is black. It's a pigmented organism. I think we're killing them without even knowing it. So maybe next time I'll build a laser to kill Demodex, right? But this laser should starve them to death, right? Anyway, I think I better end. The bottom line is the laser's in your hands now, and I think clinicians are really able to understand what's going on, how to use it best. You can listen to people like me, and you can listen to people from the company tell you about all the physics. The truth is, what this laser in your hands, what it's doing, is what really matters. So thanks very much. These are my kids, by the way. A result of working with that free electron laser is I got married to Fernanda Sakamoto and we have children. So that's a side effect for sure. Thank you.
Thank you very much, Professor Wellman, for a very wonderful, inspirational presentation. It's going to be one of a memorable presentation for all of us. Next, I would like to